Good Good morning, everybody. Thank you for attending the March 2023 in-services. And the first in-service today is on Vertigo, and it's going to be given by Hunan. So we're going to turn it over to Hunan. It's all you.
All right, good morning, everyone. My name's Hanan. My presentation's titled Getting to Know Vertigo. Oops, sorry. Okay, so some of my objectives and what I think I want you to be able to get from this presentation is being able to explain what vertigo is and the different types, understand the causes of vertigo, and then also be able to describe the treatment options for it. So I wanted to start out by talking about what is vertigo itself. So vertigo is the sensation that the world around you is spinning essentially, and it can lead to feeling both dizzy or off balance. I did want to mention that it's not necessarily a disease state on its own, but more so a symptom of varying conditions. And then the other thing I wanted to mention is the difference between vertigo and dizziness. So both of them are related to this loss of balance. However, vertigo, again, is that sensation that you're moving or that the surroundings are moving. However, with dizziness, it's more so this overall feeling of being unbalanced. And so the reason that this is an important topic to talk about is because around 40% of the US population will experience vertigo at least once in their lifetime, and women are also more likely to experience it as opposed to men. All right, so getting into the different types of vertigo, so there's two different types. We have peripheral, which is associated with vertigo that's related to the inner ear, so that can mean that you have either an imbalance or need a repositioning of this labyrinth or semicircular canals that you see on the bottom. And the other one is central vertigo, which is basically associated with vertigo related to the brain. And that's usually in regards to the spinal cord or the cerebellum. And both of those organs are in charge of controlling motor movement and controlling balance. And so that's why we have this off balance feeling. All right, so getting into some of the causes of vertigo. So I kind of broke them up based on whether it's peripheral or central. So the most common cause of vertigo is going to be this benign paroxysmal positional vertigo, or BPPV. Essentially what that means is when you're having these changes in your head position, it's causing that vertigo to occur. So that can include either lying down, sitting up, or turning over in the bed. The other cause can be Meniere's disease. And so what that is, it's basically this fluid buildup that occurs in your ear. And it's also associated with tinnitus. So that's basically when you have this ringing in your ears and you get this fluctuating hearing loss, or your ears feeling very full. Another cause of peripheral vertigo is this labyrinthitis. Essentially, that's inflammation of that labyrinth or that semicircular canals that I mentioned before. And it can include the vestibulocochlear nerve as well. Essentially, it sends information to the brain regarding sound. And so this is one that does alter your hearing. The other one is vestibular neuritis, which is inflammation of the vestibular nerve. So unlike labyrinthitis, this is still inflammation. However, it doesn't alter your hearing. And then the last thing that we think of in association with peripheral vertigo is going to be medications that can lead to ototoxicity. And those include aminoglycoside antibiotics. So some examples of those can be amikacin, gentamicin, or tobramycin, along with cisplatin and then some salicylates as well. So moving on to central vertigo, some of the causes of that can include stroke. So that can be both ischemic or hemorrhagic. So an ischemic stroke is essentially when you have something blocking off a blood flow to the brain, and that That can be like a clot, which is typically why we use clot busters to relieve that. And then your other type of stroke can be hemorrhagic. And so that's basically where you have a blood vessel in the brain rupture. Other causes can include tumors, and that is both cancerous and non-cancerous. You could have head injuries that are associated with it, so having like a concussion or like a skull fracture. Migraine headaches as well, and then multiple sclerosis, which is essentially an autoimmune disease where your immune system will eat away at this protective covering of the nerves that affect both your brain and your spinal cord. And then again, we have medications that can be affecting the brain. So you want to avoid those. That includes like those that cross the blood-brain barrier. So that can include anticonvulsants, aspirin, and then alcohol as well. So again, I wanted to mention, even though vertigo is not a disease state on its own, it is a symptom of multiple disease states. However, you can see these symptoms that are also associated or occurring concomitantly when you have vertigo. And so those can include nausea and vomiting, tinnitus, which again is that ringing in your ears, this trouble of keeping your balance. You can have some headaches and then also some motion sickness. And so a lot of the treatment can also be in regards to treating some of the associated signs and symptoms with vertigo. So treating nausea and vomiting with antiemetics or treating motion sickness with like Dramamine. And so next I wanted to move on into the diagnosis of vertigo. So there's a few different tests that can occur. We have the first test, which is called the Fukuda-Unterberger's test. Essentially, it's basically where you march in place for 30 seconds with your eyes closed and your hands out. And if you lean toward one side or you rotate, it could indicate that you're having an issue with like your inner ear, resulting in that vertigo. And so there's a picture of that to the left of the screen, and they have like indicators on the floor that determine how much you've moved, and then if you've moved at all. The other test includes the Romberg's test. So this is the one on the right of the slide. And this is basically where you close your eyes and you stand still with your feet together and your arms by your side. And then essentially, if you're feeling unbalanced or unsteady, it's possible that you're having an issue with your central nervous system. So this will be more so the central vertigo that you're experiencing with your either brainstem or cerebellum. The other test is going to be this head impulse test. This one, you basically focus on a stationary target, and then your provider will gently move your head to each side. And basically, they're looking to see your eye movements while your head is in motion, which will determine any issues that you're having with your inner ear and your balance. And then the other test is going to be your vestibular battery test or vestibular test battery. Basically, this is several different tests that are done to determine any issues with the inner ear or the labyrinth. Essentially, they're placing goggles on your head, on your eyes to monitor your eyes' response to following like a target, following any movement with your head and your body, and then also following any movement that you have when you have warm or cool water placed into the ear canal. And then the other diagnosis includes like a CT scan and an MRI of the brain as well. So I wanted to start off with talking a little bit about some ways to prevent vertigo from occurring. So you want to make sure you're taking extra time to stand up, move your head, or any other like triggering activities that are affecting your vertigo. You want to try to sleep with your head elevated. So this can include like elevating the head of the bed or just using multiple pillows. Sitting down if you're feeling dizzy, and then instead of like bending over to pick something up that you've dropped, you can consider like squatting, and that should be a little less painful. All right, so getting into the treatment of I'll talk about peripheral vertigo first, and then we'll go into central vertigo. So peripheral vertigo, again, BPPV is the most common cause of vertigo. And so the way we treat it is this canalith repositioning maneuver, also known as the Epley maneuver. And essentially this is where you have like head position changes to help reset the balance organ. So again, that vestibular labyrinth. And if you have any like calcium deposits build up, it's built to help move those as well. And I'll show you a picture of that on the next slide. For Meniere's disease, the treatment can include like surgery, medications, and change in diet. So again, this is when you had that fluid buildup in the ear. So medications can help to decrease some of that fluid. And then there has been some evidence indicating that if you eliminate coffee or caffeine, alcohol, and salts, or reduce them, it can help reduce the frequency of symptoms that you have associated with Meniere's. And then with labyrinthitis, again, we're going to use medications to treat that, and that can include like antiviral medications if it's a viral infection, antibiotics if it's bacterial, and then corticosteroids for any inflammation that you have. And that's also true for vestibular neuritis. So the same medications would play a part there. And then the other thing, like I mentioned before, is our ototoxic medications are medications that we want to avoid in this type of vertigo. However, that's something that your provider would be able to talk to you about. Okay, so this is just a picture of the canalith repositioning maneuver. So essentially, your provider will move your head in different ways to kind of balance out the organ and move any like calcium deposits that you have. All right, so getting into treatment for central vertigo, essentially the treatment for this is treating the underlying disease state, and most of these require hospitalization. They're more severe. So with a stroke, we're gonna give medications that allow the clot to break down and allow for adequate blood flow to your brain. For tumors, again, we could have like surgery to remove any like tumor to prevent further damage, whether that's cancerous or not. We can use like OTC medications for migraines, such as like NSAIDs or caffeine. And then for multiple sclerosis, we typically use immunosuppressive therapy because it is an autoimmune disease. And then in this type of vertigo, you want to avoid medications that will cross the blood-brain barrier. All right, and then the last thing I wanted to talk about a little bit was home remedies. So I did want to mention that there's not enough evidence behind these options. So you want to make sure that you're speaking to your doctor before you incorporate these into your daily lifestyle. But these are things that a lot of people have been using, and so it's just something I wanted to touch up on. So one of the options is turmeric. And so similarly to a corticosteroid, this is seen to reduce some inflammation. And so patients that have like labyrinthitis or the vestibular neuritis, it can be beneficial in that regards. Ginkgo biloba is thought to work by managing blood flow to the brain and basically help relieve like dizziness and balance issues. And then ginger root will work to reduce dizziness, nausea, and then other vertigo symptoms as well. And then these are just my references, and I can take any questions that you have now.
So if anybody has any questions, feel free to unmute yourself and ask, or type them in chat. And I agree, Hunan, as Raina said, good job. I'll give it another minute or two to see if anybody else pings in. Alrighty. I don't hear any, and I don't see anybody unmuting themselves. So thank you, Hunan.
Yep, thank you.